If you look at our training, it hasn't changed much over the years. While we have healthcare changes looming, unsustainability, so many other issues beyond, if a test is appropriate.
Physicians typically practice as they were trained, and that's actually good news, because if we change the training of physicians, we can change how physicians practice. But unfortunately, much of physician training is counter to the recommendations in Choosing Wisely.
Interns and residents don't yet necessarily feel comfortable that it's okay to wait, and may feel that they need to be doing something, whether it's a diagnostic test or a treatment or whatever.
They have heard the statistics. They've heard about healthcare consuming GDP. They're going to be the ones that inherit the system, and they want to be part of the solution.
Certainly one of the very important next steps is the training piece. It's to actually teach people how to go about making high-value decisions.
We know, obviously, that the practices that physicians pick up as they train get carried on lifelong. And so you really can make an impact when you reach that group.
That being aware of waste and being aware of potential harm is just as important, and perhaps more important, than knowing the latest possible thing you could do. Once that becomes part of what doctors are expected to do, then it lives and breathes and walks and talks in the training space, and lots of people take on projects to make Choosing Wisely a reality.
Today's trainees, our medical students and residents, I think have a deep understanding that the resources we have in healthcare are truly precious, and that we should be good stewards of them. And so when the Choosing Wisely campaign is translated to education, it's totally consistent with their desire to use resources better.
The hope is our young people, and the fact that the Choosing Wisely campaign is stirring their imagination and is, I think, offering great optimism for all of us.